So question number 2 is pharmacology. Okay, and this is also one of the test content of your NCLEX. So let's discuss question number 2. The nurse is checking the medication administration record, or the MAR, for your assigned client. Which of the following drug prescription should the nurse question and verify with the doctor before administration? Select all that apply. So which of the following drug prescription here, that we need to question or we need to verify? Okay, so number 1, or letter A, sorry. Okay, you have Foslo in client with chronic renal failure. Phosphate level of 5.5 milligram per DL. I know it's hard for you to understand what Foslo is. Okay, so and then you need to understand also your normal values before taking your NCLEX, because you can never answer and you can never analyze letter A if you don't know your normal values. Am I correct with that? Okay, so know your normal values first, and then know your medication by heart. Okay, so what is Foslo, nurses? So let me discuss letter A. Letter A, your Foslo is considered to be a phosphate binder. When you say phosphate binder, it decreases, the phosphate levels in the blood for a client with chronic renal failure. In patient with CRF, there is decreased excretion of the phosphate, leading to your hyperphosphatemia. And then there is also decreased level of your calcium. If you have decrease in calcium, it can inversely increase the level of your phosphate. That's why we need a phosphate binder. But is phosphate binder correct in letter A? Let's continue. Let's check the phosphate level. The phosphate level of your client is 5.5. Is phosphate binder good for that client? Okay, what's the normal phosphate level? The normal phosphate level is 2.4 to 4.4. So this time your client has 5.5 milligram per DL. Is that hypophosphatemia or hyperphosphatemia? Yes, you're correct. It's hyperphosphatemia. Okay, so ask yourselves again, will my client benefit from using phosphate binder because I have increased amount of phosphate in the blood? Yes. Okay, so Foslo can bind phosphate in the blood, decreasing the phosphate, so this will answer hyperphosphatemia. So I cannot question letter A because letter A is a correct drug prescription. Okay, so eliminate letter A because we are talking about which of the following drug prescription should the nurse question. So eliminated. Okay, letter A. Okay, let's proceed to your letter B. Letter B, nurses, is lanoxine. Going back to your pharmacology, lanoxine is a digitalis that can increase the contractility of the heart because it has positive inotropic effect. And that is of course indicated for a client with CHF. Okay, so lanoxine is indicated for a client with CHF. But remember, your lanoxine or your digitalis has narrow margin of safety. It's a drug, which has narrow margin of safety. When I say a drug with narrow margin of safety, the therapeutic dose is very close to its toxic dose. That's why you need to get regularly the blood levels of your lanoxine. What's the normal blood levels of your lanoxine? The normal blood levels, nurses, of your digitalis in the blood should be 0.5 to 2.0 ng or nanogram per ml. Look at letter B. It's correct. Lanoxine is indicated for CHF and the digitalis level in the blood is around 1.5 nanogram per ml. Okay, should I question the order? No, because the lanoxine or the digitalis level in the blood is within normal. So A and B are all correct orders, right? Okay, so I don't need to question letter A and I don't need to question letter B. Okay, so letter A and letter B are now eliminated. That is how to answer NCLEX question. You should have a good foundation of your medication, and then at the same time your normal values. Okay? So let's check letter C. Letter C, nurses, is Demodex. Your Demodex nurses, okay, if you can still remember, the generic name is torsemide. And torsemide is a potassium wasting diuretic. Okay? So Demodex is, okay, a potassium wasting diuretic agent. When I say nurses potassium wasting diuretic agent, the complication is hypokalemia. You will excrete a lot of potassium via the urine, leading to hypokalemia. Okay? So, Demodex is diuretic agent, which is considered to be a potassium wasting diuretic. Let's check the potassium level of your client. The level of your potassium is at 3.0. What's the normal potassium level? So again, you should know your what? Normal values. The normal potassium should be 3.5 to 5. Okay? So at a level of 3.0, you can consider that as hypokalemia. Okay? So since you have hypokalemia in letter C as your case, okay, try to ask yourselves, nurses, can I give potassium wasting to clients suffering from hypokalemia? Obviously, no. Why? If I give, okay, potassium wasting, okay, diuretic agent, the more potassium, okay, will be eliminated, leading to hypokalemia. And hypokalemia can lead to cardiac abnormalities or cardiac dysrhythmias. So in letter C, Demodex is potassium wasting diuretic agent that can be given to client with congestive heart failure due to water retention, but then your case, you have hypokalemia. So you need to question letter C. Never give potassium wasting diuretic agent to client with hypokalemia. Alright? Okay, so letter C is correct. What about letter D? For letter D, nurses, it's INH, an anti-TB medication. So the indication is correct, right? Okay, so it's an anti-TB medication. Okay, and then look at the ALT level. The ALT is the same with your SGPT. The ALT level or the SGPT levels of your client is 100 units per liter. What is the normal ALT or SGPT? The normal is around 5 to 55. 100, okay, level of your SGPT or ALT is very high. Okay, so this will indicate now hepatotoxicity. Since INH is considered to be a hepatotoxic medication and your client is suffering from, okay, liver problem this time, so question this order also. Why? Again, INH is hepatotoxic. So the more, okay, that can damage the liver function. Remember, the client is already what? Has a high level of SGPT or ALT. So question this order because INH is hepatotoxic medication. So, okay, question this order. What about letter E? Letter E, Flagyl in client with Clostridium deep, okay, infection. So Flagyl is antimicrobial, anti-infectives. Okay, so that is a good indication. Okay, with white blood cell level of 15,000, should I question this order? No. It's expected for a client with infection to have leukocytosis or increased level of white blood cell. Your white blood cell should be within 5,000 to 10,000. And 15,000 is expected for infection, right? Okay, for patients suffering from infection. So, Flagyl will answer, okay, your infection. Okay, so I don't need to question, okay, order letter E, okay? So, letter F. Inderal in the client with hypertension with medical history of asthma. Should I question this order? Okay, in your pharmacology, I have, okay, to highlight that your Inderal or your propranolol nurses, okay, I have to write here, Inderal. The generic name of your Inderal is propranolol. Okay, so let's have some, okay, explanation here. So Inderal is, okay, the generic name is propranolol. We have two types of beta blocker. The selective, okay, beta blocker and the non-selective beta blocker. Okay, but for your Enderal or propranolol, this beta blocker is non-selective. Okay, so the other term, okay, this type of beta blocker is a non-selective. Okay, non-selective beta blocker. When I say nurses, non-selective beta blocker, I have to go back first to your anatomy and physiology before you can understand letter F. Okay, so let me discuss, okay, your two types of beta receptor site. The first one is beta 1 receptor site. Your beta 1 receptor site is located in the heart muscle. If I stimulate beta 1 receptor site, there is now increase of your heart rate. Okay, while stimulation of beta 2 receptor site can lead to your bronchodilation. Okay, this can lead to bronchodilation. Your medication is Inderal, propranolol, a non-selective beta blocker. When I say non-selective beta blocker, it will block beta 1, right? If you block beta 1, it can decrease the heart rate. If you decrease the heart rate, you can decrease the cardiac output and you can decrease the blood pressure of the client. That's why beta blocker can be considered as an anti-hypertensive agent. Am I correct with that? If you decrease the heart rate, you are decreasing the cardiac output. Then eventually, it can also decrease the BP of your client. So a beta blocker is an anti-hypertensive agent. But propranolol is non-selective beta blocker. Although it has blocked the beta 1 receptor site, it can also block beta 2 receptor site. If you block beta 2 receptor site, blocking of the beta 2 can lead to bronchoconstriction. So the opposite will going to happen, right? Okay, so the client will develop bronchoconstriction instead of bronchodilation. So since you have bronchoconstriction, the airway is narrowed this time. So can you give propranolol or a non-selective beta blocker to client with bronchial asthma? Bronchial asthma patient has a characteristic manifestation of bronchoconstriction or bronchospasm. So do not give a beta blocker which is non-selective because yes, it can answer hypertension, but it can also block beta 2 receptor site. Blocking of the beta 2 receptor site will give you bronchoconstriction. So that can further complicate, okay, your bronchospasm in patient with bronchial asthma. So do I need to question letter F? Yes, okay? Question letter F because Inderal should not be given to client with history of bronchial asthma. Okay, so I hope you get the correct answer. So the answer for number 2 is letter C, letter D, letter F. Okay, so know your medications and know the normal values. This is NCLEX, okay, type of questions that you need to understand. Okay, so this is pharmacology, one of the test content in your NCLEX exam.